segment is brought to you by Chase Brexton Healthcare.
Well, the Power Project of Chase Brexton Healthcare is focused on sex-positive sexual health to keep our communities healthy. Their goal is to provide education, testing, protection, and treatment without any shame or judgment. Now, joining us is Jahi Omari, coordinator of the Power Project of Chase Brexton. All right, Jahi, thanks so much for joining us here today. Now, what is the Power Project all about?
So the Power Project stands for protecting ourselves with every resource. And the Power Project was created to focus on reducing HIV and STI transmissions in a powerful and sex-positive way.
Now, why are those sexually transmitted infections and HIV such a focus at Chase Brexton?
So, you know, people have sex, and sex, when consensual, of course, is a healthy and important part of our life. But it is important to note that around half of us will have a sexually transmitted infection or STI in our lifetime. Some STIs can go unnoticed, some can be very uncomfortable, and worse, they can lead to long-term health effects. And if you don't know that you have HIV or an STI, then you can pass it to others. So we're just really focused on reducing the stigma around HIV and STIs and talking about it.
All right, so what should somebody do if they think that they have an infection?
So if you think you have an STI and you are a Chase Brexton patient, we do have a walk-in clinic, which is Monday through Friday starting at 8:30. It is first come, first serve. So we ask that you come as early as possible to see the healthcare provider, or you can schedule for one of our Power Clinic hours, which is Tuesday and Friday from 1 to 5. And you would just call the Power Hotline, 410-837-2050, extension 8813. And if those hours don't work for you, we can schedule you for a different appointment. And again, if you are interested in becoming a patient, then you just call our hotline. But if you can't get to Chase Brexton, then we just recommend you go to your local ER urgent care to get tested.
Okay, makes perfect sense. All right, talk to us about PrEP and PEP.
Yeah, so PrEP and PEP are both ways to prevent HIV infection. PrEP stands for pre-exposure prophylaxis. You take PrEP if you are HIV negative. It's a pill you take once a day. And if you take it once a day, then you can't get HIV. PrEP isn't for everyone, so it is important to talk to your provider to kind of go over the pros and cons of PrEP. But then you get lab work done that day, and then you get lab work done every 3 to 6 months just to make sure everything looks good. And if you have any concerns about like insurance, there's resources to cover the cost, and you can get medications that day. And then PEP stands for post-exposure prophylaxis. So you take this if you're HIV negative and you think you were exposed to HIV. Within 72 hours, you have to take it. But if you don't take it within 72 hours, then it won't work. So if you had unprotected sex on like a Saturday night and you think you were exposed, you would want to see us or an ER by Monday.
Okay, I had no idea about either one of those. So if our viewers are equally as interested and feel like they may want to take advantage of that, where can they find you?
Yeah, so you can give us a call on our Power Hotline, again, 410-837-2050, extension 8813, or you can check out our website to just be updated on any changes and things like that.
Okay, and again, all the information also available there on our screen. It will also be on our website, foxbaltimore.com. Jahi, thank you so much for joining us today and giving us all of that great information.
Thank you.